Hi, and welcome to Hypnotize Me, the podcast about hypnosis, transformation, and healing. This is Dr. Liz. Today's interview is with my good friend, Dr. Lorri Beauchamp, who we've known each other for a couple of years, and we recorded it in the loft in my house and just had a really fun time talking about the rapid resolution technique. She actually talks about several hypnosis experiences that she had, and she has a unique perspective because she was first client of hypnosis, had it done several times, and then decided to study the rapid resolution technique and become trained in it herself. She does a lot of acupuncture for fertility / infertility for women, and she's a women's specialist, and just began to believe that this technique was an integral part of their treatment and their ability to get pregnant. So she decided to get trained so that she could offer it to her client. So she gives a little bit more of the history of the technique and some of the background of it, more so than we heard in last week's episode, I would say. And the way she explains it, it just makes it very clear. So I think you will enjoy the whole interview. Before we jump in, I have to let you know that my daughter, after a 4-year campaign, somehow convinced me to get button quail. Button quail are like the tiniest birds. I don't know how she convinces me to do these things. She's the one that originally convinced me to get the dog. That took more like 12 years. But, sometimes as parents, we have these small moments of insanity, I call them, where a week later, you're like, well, why did I do that? But then you're like, well, they're not so bad, that dog or those birds or, whatever it is, right? Anyway, you may hear them scratching in the background sometimes, or they're tiny little chirping. They're actually very, very quiet birds, but they are birds. I'll try to edit a lot of that out, but I wanted to give you the heads up on that one. Okay, let's jump into the interview. Okay, so welcome to the Hypnotize Me podcast. And I'm going to start off with the question that I ask most people. What was your first experience with hypnosis?
My first experience with hypnosis was I wasn't sleeping well I was mugged. And I just looked it up on Google and tried it and immediately fell in love with hypnosis.
Oh, so it worked for you then?
It did.
You bought a download?
Well, I'll say I didn't think it worked. I was like, I don't know if that worked. I mean, I feel relaxed, but I think she just stole my money. And then for the rest of the day, everyone's like, wow, you seem so much lighter. You seem different. And I really did sleep better after that. It was really interesting.
And it was just a random site that you found?
Yes.
Interesting.
Through Google.
Through Google. Okay, Great. And you'd put it on at night? You would put it on before you go to sleep, basically?
I went to sessions. I went to actual hypnotherapy sessions.
Oh, it wasn't a download.
It was not a download.
Oh, so you went to hypnotherapy sessions for insomnia?
Yes.
Got it. How many?
2.
2. Okay.
Yes.
And then did she send you home with the recording or no?
No. I wish you would have told me this ahead of time. Because that was really helpful to have that around. She did not give me that option.
Right.
But now I'm more educated. Thank you.
Yeah. Some therapists do recordings. Some therapists don't. But generally for insomnia, I almost always, 100%. Because it's insomnia, they can listen to it as they fall asleep.
Right.
That's the whole point.
I was pretty naive, but now I know. So thank you.
But then it did work anyway.
It did. And it kind of casually crept up on me because I was quite sure she didn't do anything to me. But charged me money. But it really did work. It reduced anxiety greatly. And promoted better sleep.
Good. So it wasn't just insomnia. It was really the anxiety you're talking about.
Probably post-traumatic stress.
Yeah.
To be really accurate, post-traumatic stress from a crime.
So she was working on that.
Yes.
To reduce some of the anxiety so that you could sleep better.
Fall asleep at night. Correct.
Okay. Got it. And it was only 2 sessions?
Yes.
Okay. Was it the rapid resolution? It wasn't just a general?
Just a general.
Okay. To finish that sentence, the rapid trauma resolution technique, which we're going to talk about in a couple of minutes here. So it was just a regular hypnotherapist that you found? And
Yes.
Okay.
Yes.
And how long was the session? Was it 60 minutes?
I believe it was an hour or an hour and a half. I think it was an hour. But now that you're reminding me, I think 2 years later, go see a rapid resolution trauma therapist. And that was a different experience. And that was, I think, like 2 hours.
2 hours. Wow.
Yes.
It's a long session.
Yes.
Okay.
It was. But it goes by fast because you're in
well,
hypnosis,
yeah. Right. No, yeah, you're right. For the person getting hypnosis, it feels like 5 minutes, sometimes 10 minutes.
Yes.
Well, 5 minutes per hour.
I call it meditation for lazy people because I love to meditate, but it takes so long to get me there. But if I just go get hypnosis, I'm down for the count. It's great.
Yeah, true. It's very nice like that. People go right out.
Exactly.
Yeah. What did you go in for that time then?
I think I was having anxiety for a different cause. If I remember correctly, I was just kind of stuck in life and having some anxiety. I think it was work-related, just work-related anxiety, about what to do next and how to move forward. And I felt paralyzed. That's how I described it to the rapid resolution woman, is that I felt paralyzed by life and I had this anxiety and I didn't know what to do with it.
Okay. And then she did the rapid resolution technique for you.
She did, yes.
And that was 2 sessions? One session,
yes.
2 hours.
Yes.
Okay. And did you feel like it worked?
She was amazing.
Ah.
She was amazing.
Uh-huh.
Yes.
And you found her through Google as well?
She came into our office where I was looking to rent space, so I just kind of met her casually. And I liked her right away and found her credible. And then I had spoken to a few people that had worked with her, and she said she was amazing. They didn't think she was just doing hypnotherapy. They thought she was like a psychic or magic or something. So the feedback was amazing. So I was like, oh, well, why not?
Yeah. That's often how people feel about hypnotherapists. Like, really.
There's like this.
I don't want to sound narcissistic here because I'm totally not. But they often feel that way. Like, somehow this is beyond just a technique, quote unquote. Like, it creates change in life that feels like, how did you do that? How did I resolve that? Like, it feels like magic to them. It feels like magic as a practitioner often as well. Like something, I've said this before on the podcast, like something, like I'm just a vessel for something. I don't even know what it is, you know. But
you're like, oh gosh, that worked. Wow.
Yeah, yeah. Sometimes I'm like, this is a miracle. It feels like a miracle to me too. And I understand some of the neuroscience behind it and all of that, but there's an element to it that feels even beyond that to me.
Well, I think that was the difference between when I saw the quote-unquote regular hypnotherapist, because I'm not sure of the proper title, versus the rapid resolution therapist. The first time I left thinking, I don't know if she did anything. Like, really, I mean, other people noticed, but I didn't really notice. And when I went to the specialist that handled the rapid resolution, I was like, wow, something happened in there. But again, not knowing how it worked at that time, I just thought she was magic. Now I studied it a little bit more. There's a method there. She wasn't making that up. But it was pretty amazing. I felt almost like, I was like, is this energy medicine? Is this Reiki? What is she doing? It was a completely different experience.
So then you had that. How long was it between that and you decided to get trained in it yourself?
I'm going to say 1.5 years, approximately.
Okay.
Yeah.
And why did you decide to get trained? Like, did you keep looking at it, like wondering what she did, or was it?
I did because it was fascinating, kind of a mystery. And then, to be quite honest, then I found there was a local training. Having to drive 30-35 minutes to a training as opposed to flying across the country made it seem more desirable. The truth to it is I wanted to understand what she did, and then for my own, I wanted to help other people. So what was happening is I was trying to send everybody to her. Oh, you have to go see this woman. You have to go see this woman. You have to go see this woman. Here's her card. And people weren't going. I thought, well, what if I just get trained? And if I want to do something different with my life, maybe I can do it. So I just wanted to understand better and then to keep it as like, what am I going to do in retirement? Needlepoint or hypnotherapy? I had to keep my options open.
Or both.
At the same time.
Yeah.
Because my conscious can do one of this. My conscious, we'll see how that goes. Who knows what I'll needlepoint?
Yes.
Totally like, oh.
There's some pretty cool needlepoint these days.
Right. And who knows what'll come out of that gray matter?
Yeah.
Wow, that could be a whole club.
Right. So what women were you sending? What people were you sending? Because like I said in your introduction, like you're a traditional Chinese medicine acupuncturist. Mm-hmm. So were they coming into you for fertility? I know you're an infertility/fertility specialist. Yes. Or were they coming in for just various things and you're like, you have to go see this person?
Well, yeah, I'm a doctor of Oriental medicine, technically. And then, no problem. I did my fellowship in fertility, they call it, in reproductive medicine. And what I'm finding is the longer that I've done this, the less black and white it appears, the less defined it appears. It just gets more and more ambiguous as time goes on. And I realize that, there's so many things we can do for women scientifically. There's like a list of instructions we can give you. There's a dietary advice. There's lifestyle advice. I can do all of that. But when you step out of my office, I can't tell you to relax or get your body to slow down or to just receive what just happened. So you might come to see me once or twice a week, but those other 5 days when you're in complete panic mode and stressed about the process mm-hmm. or the lack of the progress or process, I have no control over that. And I was hoping to kind of compensate for those 5 days I wasn't there uh-huh. and help this carry them through.
Okay, so it was like a complimentary
It was, because I feel like something was missing. I'm like, you've done everything right for all these months. Here we go. And now you're going to have a panic attack? Let's just stop this. Let's stop the panic attack. Mm-hmm. So, and that was my goal.
So was it effective for the women who did go in?
Yes.
It was? Okay. It was. So then they were able to, I don't even know what the word effective means here. Like less anxiety, less panic, or they ended up getting pregnant. Like it was a compliment to the acupuncture or what?
I think how different people describe it is about perception. And the way I perceive it is I'm just trying to, yes, we're reducing anxiety, reducing stress, putting you into a more meditative state. But I like to believe I'm just giving them a sense of self-empowerment. Mm-hmm. So when they step out of the office, they're like, no, she's right, or I'm right, or the brain, I have done everything right. This could actually go really well. I'm okay. And get out of that state of mind where they're just stuck in this fear mode because it's really no longer benefiting them. Mm-hmm. The fear they had that got them into the office or to a doctor or on medications or on herbs or whatever it took, they've done all that. The whole fear that was there to make them take action, mm-hmm. it should not even be there anymore. Like dismiss that. All you have to do is show up now. And so removing that fear was the goal.
So you just have to show up and be present for the baby that's coming.
Right. For example, if a woman's done everything she possibly can mm-hmm. to conceive and all she has to do is show up at that office tomorrow morning at 8:00. Why are you panicking now? You've done everything. You should be on autopilot. Mm-hmm. You've done everything the doctor said, everything we said, everything you thought you could do. We just have to change kind of the mindset, for lack of a better word. Mm-hmm. So now's not the time to panic. Now's not the time to be afraid. You being afraid a year prior, which made you go in for any kind of imaging or lab work, it made you take action. Mm-hmm. So get rid of it. It's not going to do you or the baby any good now. Stop it. So
then the rapid trauma resolution technique helped release that to where they could just release it.
Yes.
Interesting.
Just not necessary at that point to be afraid. Uh-huh. You're afraid it's not going to work. It's not beneficial to you, the baby, or anybody. At that point, it is or it isn't. So let's just be happy and assume that it is.
Yeah, that is really difficult for
people.
It is.
We just get stuck in this pattern.
To release those old patterns.
Right.
So that is one of the primary goals of the technique, is to release the old patterns.
Exactly.
Okay. Once you got trained in it, did you feel like, okay, now I have the tools to help people? Did you feel like it was less magic, or there was still some?
Oh, no. It's still magic. And there's still so much. Every time I think, I've got this figured out, I can write a book now. I'm like, there's a new chapter. Shucks. Right? No, I think the human mind is still like an abyss. It's like the ocean or space. We still don't really even understand how it works. And we want to think we do, but we don't. I don't think I learned the method and I read the science part of the textbook, so I get it. But to me, there's this huge, vast, invisible space of wow, this really works. And I think it's because we can't see what it's doing. Oh. So it takes longer to trust you know, and I try to compare it to a cell phone. I can't really tell you why my cell phone works, but I know it does. I use it every day, all day. But it works, right?
True,
I can't see the waves going off a tower, bouncing, pinging, but it works. And so the same thing with this. It works. So because I personally can't visualize it and a lot of people cannot, that's where the whole magic comes in.
Yeah. Tell me what this technique, like what can it be used for? I know it's not just for panic.
I think it's most commonly used for victims of any kind of trauma. I think the gentleman the doctor that invented it was using it for sexual trauma. Quite often physical abuse, drug abuse. Seeing in my own practice a deficit and seeing people that actually are going through a trauma. Even if they don't want to actually call it that, and they might not realize it's that until years later. It's a trauma to be told you can't conceive when you think it's just a basic human right. So it's not commonly used for that, but that's what I was reaching out for. But it's used for all sorts of things, and people that lose a loved one that can't quite get, whenever you're just stuck. If you're just stuck and you can't quite get past something, if you want to get past it, this is a way to, I think, kind of biophysically get past it. So there's the whole, you're holding it somewhere, this pattern in your brain, and moving it to another part of the brain so you can just go function again. And that's kind of like how I scaled it down to my own personal practice of, okay, you've done everything, let's scale it back and let's just go forward and not get stuck on this fear pattern when it's not serving you.
Oh, okay.
So I think that the doctor that devised it had the same thing. If something traumatic happened to you at 19 and it was horrible, let's acknowledge it, but does that have, like, that was really you at 19. It's not you at 29 or 39 or 49. So when we carry that with us, why? Is it helping you to still carry? To carry, is it helping you? No. And you can actually carry that fear onto your offspring. So having that fear within you, is it going to help your offspring? Like that trauma, that tragedy? And it doesn't make you forget anything. It just makes you not live as if it's in the present. Does that kind of make sense?
Yeah, okay. It does. Yeah. Well, I know trauma often comes up during parenthood, and parents worry about that. How is this going to affect my kids? And it'll often get re-triggered when they become parents. They can even push it away for many, many, many years. But then, particularly for women, birth, breastfeeding, a lot of that will bring up any kind of sexual trauma they had. And it does make sense to me. Let's see how we can shift this around so that it's not a daily fear, worry. It's not a daily presence in your life. Like I did another interview. I'm not quite sure which one is going to air first, this one or that one. Okay. But where he said it was 2 sessions and it was gone. He was working with sexual trauma victims, measuring pre-test, post-test on depression, anxiety, and everything. And it did really release. So that does make sense to me.
Well, it does, and some people get afraid when you talk about it, like they don't want to forget because they don't want to become vulnerable, or they don't want to just dismiss that from their lives. But how he explained it was like he uses animals as a reference because we actually are animals. And if this was already said, forgive me, but if a bunch of zebra are running away from this lion and the lion doesn't get the zebra, or it kills his friend and eats this friend, and the one zebra, you're one zebra less. And if you go up to that zebra an hour later and be like, oh my gosh, I'm so sorry, your friend the zebra died, he's going to be like, what? I'm just here eating grass. There's no lions around. I'm okay. Like, as an animal, using that primitive part of the brain, he's let it go, and he's back into the present, and he's eating grass, he's drinking water, and he still knows if there's a lion coming, he's going to run, but he's not going to spend the next 7 years of his zebra life in a state of malaise and fatigue and depression and not eating and weeping because his friend has passed. So we as human beings were like partially evolved. Like we've gone past that. We do, grieve and celebrate and do things in remembrance, but to relive the trauma as if it's now, that part of our brain is still there. We don't need to be doing that. So for example, when I received my therapy for it, either time, like the time that I was mugged, I was having stress about 1 o'clock in the morning. I would wake up kind of in a panic because that's kind of between 12 and 1 is when I was mugged. And I was waking up in a panic. Well, my attacker was no longer here. It's, 1 or 2 years later.
Yeah.
So it's not like I don't look over my shoulder, or I'm not more careful walking, locking doors and going out of. I'm still cautious, but I don't have to wake up at 1 o'clock anymore afraid that someone's punching me, because they're not. But my body was still thinking, oh my God, it's 1 o'clock. You better protect yourself. Your adrenaline is shooting up and you better fight back.
Yeah.
And it wasn't serving me any longer. So it released that.
Fascinating. Isn't it right? Yes.
I mean, now it's just normal, but it was fascinating back then.
Yeah. So I know that there is some literature that says you do have to relive that trauma, and that is how you resolve it. And I'm wondering, like, this technique sort of breaks a lot of those boundaries, because if you talk to, let's say, a more quote unquote traditional trauma therapist, I mean, sometimes you're talking about years of work there.
Yes.
Or at least like months and months of work, versus you're saying this can happen in a couple of sessions.
Yes, it can, for most people. And what I've learned from the doctor that kind of invented this technique, Dr. Connolly, was that because he was trained as a traditional therapist, and it was his job almost to like make people relive it. Because I think if you relive it, then you can work through it somehow. If you cry some more, you can get through it somehow. But really, we have to look at, why is that working? Why would that even work? Like, he's kind of questioning, he's pushing boundaries. I call it almost like a pioneer. Why relive it? Why not kind of reprogram the mind? So again, you're addressing it was there, but it's no longer, you don't have to relive it. It's done. It's the past. It's not in the now. Like Eckhart Tolle would say, like, be in the now. It's not in the now. So don't keep it in the active part of the mind. Push it to the inactive part of the mind. So he says, don't relive it. Don't endure. Don't cause your patients, more pain, where every time they come in, they're like, oh my gosh, I'm going to cry with this woman for the next 60 minutes again. Like, I mean, I'm not saying it doesn't feel good sometimes, but, why relive this? And I think they even do it in the military, but they make them relive these things over and over again. Yeah. And why? Okay, so you were raped or mugged or beat up. That's really horrific. But is that you now? And what he's saying, it's not you now. That was something that happened then. And again, did you learn something from it? Did you gain? I mean, there's something, but you don't carry it with you like a handbag right now. You don't have to relive it every day or every night or the rest of your life. You don't have to carry it with you like an accessory.
And so that's how he came up with some of this. Is like, how do we shift this so people don't have to live it every day?
You don't have to relive it. If you really want to go forward in life, you don't have to reenact it, relive it. You don't really have to feel through the pain. You could just, and I can't, this isn't really paraphrasing him, but just, there's the pain, let it go. Like, seriously, let it go. Push it behind you. So for me, what happened like in 2011, done, okay? But I'm not being mugged now. So I don't have to carry it with me now.
Okay, gotcha. And that is difficult for people. I mean, I know, having been through some trauma myself, it's like right after it, you do relive it in your mind. It feels uncontrollable, actually. It's like it's there and you don't even want it there, but it's over and over and over. And so the experience of that after this technique is that doesn't happen.
Well, we're still evolving as human beings. So why are we doing this? Since we're still quite part animal, we're still reliving that, and we're kind of partially evolved into humans. So why are we reliving it? Why are we holding on to the grief or sadness?
It is really interesting because, the zebra's not reliving it.
But like, why are we reliving it? Why are we reliving any kind of grief or trauma? Like, and some people have a hard time letting go of that. Yeah. But if you really want to let go of that, then you will to move forward, because we just weren't, we're just not designed to. Why live a tortured life? Yeah. I mean, really, why live a tortured life? And it's like I say, some people have a hard time because they're like, this really bad thing happened to me.
It becomes part of their identity.
Right. Why should something that happened to us in 2006 affect us in 2026? Like, it's always going to be there, but why does it have to be so omnipresent?
One of the questions I have, though, is, all right, so it stops that reliving piece, right? Really that post-traumatic stress piece of the reliving and, let's say, the hypervigilance and all of that, right? But we also know that traumas do, particularly in childhood and those types of traumas, they can affect someone the rest of their life. Like, let's say trust is harder for them to develop, or someone who really feels like their self-worth is lower, or the shame spiral starts, and, you know, that type of thing that survivors do describe. So does it work on that level as well, like that sort of daily life level? It's not the hypervigilance level. It's not someone who's reliving it all the time, but they still carry these pieces of it with them.
Well, one of my favorite things about his training and how he practices as a professional and kind of trained us is he likes to ask the question, is that true? So say something really horrible happened to you. I mean, quite often like sexual trauma, you were raped, and something really horrible happened to you, and you think, I'm a horrible person. He'll be like, but is that true? Or you might say, but I'm a dirty person. Well, is that a true statement? Are you dirty? And he really makes you look at some truths. And so sometimes he works on the language too. The language in which we speak to ourselves is quite often full of mistruths. So when he can get you into that different state of mind, and he's already talked about the things that how we're self-talking to ourselves with a bunch of mistruths, he can get you to that kind of, for lack of a better word, that subconscious hypnosis state of mind. Are these really truths? Are you really a bad person? Are you really horrible?
It sounds like Katie Byron's work. Have you ever?
I have not.
You have not?
But
okay. Katie Byron has like these 4 questions that you ask, but it really centers on, is that really true?
Like, because we talk to ourselves with things like, oh, I'm a bad person, or so-and-so is going to hate me. And he'll be like, is so-and-so really going to hate you? Well, I don't know. So actually, we don't know if so-and-so hates you. Would you hate you? Like, he kind of talks you through it. But because you're in a more, I think, open, I don't want to say altered, but a more open mindset, how much truth is it to all of our fears? Our fears are quite often full of untruth.
Yes, right, true, right. I have a good friend who says if you want tickets to a horror show, just free tickets to a horror show, just start thinking about the future. Right? And they never come true. Like, hardly ever.
Why would I panic at 1 o'clock in the morning when I'm in lockdown in my house, double locked in a high rise at 12:48 a.m. because I'm going to get mugged? Like, I mean, is someone scaling the side of the building? That post-traumatic stress and anxiety and probably my cortisol levels probably shoot up right then.
Yes.
Why was that necessary? I am in complete lockdown, but it's still there when you need it. So if I'm walking in a dark alley followed by 6 people with knives, I can still be afraid. It's like I'm not going to react, but I'll react appropriately, not inappropriately at the right time frame. And that's what tends to happen with the human mind. Yes.
And that is the part of our mind that has evolved and plans and tries to protect us and builds large buildings and all kinds of stuff. But it's also the part that's not so useful when something like this happens.
Right. So that's kind of the whole foundation of his rapid resolution therapy. And then, like I say, on a small scale, that's when I see women for fertility. They're terrified they're not going to get pregnant. Well, why wouldn't you? You just did this and this and this and this and this and this and this. Why are you so stuck in this terror now? The terror should be done. You've done everything right. And we can do that with anything. I think once anybody even took his course, you just start looking at the whole world a little bit differently. The different colored lenses. You're like, oh, is that a truth? I always say you're right. I tell everybody, you're being dramatic. Are you really starving to death? People say, oh, I'm starving. Well, is that a truth? Are we really starving? Yeah. You can change your language a little bit. I don't think you're starving. Right. I think we're hungry, and that's the word we should probably use. I've used that one recently. Like, is that a truth? Is it a truthful statement? Are you starving? Yeah.
Right. Yeah, no, we're just hungry.
Exactly.
Yeah. I mean, some people may really be starving, but
but
not us sitting here talking about this conversation. And chances are, not most people have a smartphone and are listening to the podcast, right? They're probably not starving.
Exactly.
Yeah.
So how often do we lie to ourselves? Are we really in danger right now? If we're not in danger, then let's save that body's mechanism for when we actually are in danger and might actually need it. Let's not waste that energy and day-to-day living.
Yeah, that's wonderful. So this technique would help me do that.
Yes.
Okay.
Actually, when we turn this off, we're going to do this to you right now.
Okay, awesome. Then I can do like a solo episode on it.
Exactly.
So we're coming to the end of our time. I want to thank you for being here.
Thank you.
You know, we always have fun talking and laughing about this stuff. And it was really interesting to learn more about this technique because, you know, I haven't really asked you some of the questions I had about it. So thank you.
Oh, well, thank you for having me. I can't wait to talk about it even more.
Oh, before we go.
You're going to punch me. I guess I need a session.
My hand raised. I was like, oh, my hands go up. My kids make fun of me all the time.
You're Italian? I had no idea.
No, I know. Mia will like imitate me, you know, with like my little hand gestures and head
I
stuff.
really didn't think you were a country. I thought there was like
anyway, I have a YouTube. I have a YouTube channel if you want to go see my hand gestures. But anyway, my hands went up.
Great.
Oh, Lorri.
Yes.
How do people find you if they are interested in acupuncture services, rapid resolution therapy? Like, how do they find you?
Well, the easiest way is my website, www.drlorri.com, or on Facebook.
So
I'm
LORRI.
www.drlorri.com, drlorri.com,
Okay.
2 R's, because my mother thought I was going to be Lorraine.
Right.
Thanks, Barb. Yes.
Right.
Or on Facebook, of course.
Okay. So they can find you through your website, and I'll put that website on the show notes.
Thank you.
And they should just contact you. I know you travel a lot, so they
Yes.
should just see where you are at the time.
And if they're a good candidate, we can do a phone consult and see if this is an appropriate fit for them.
Okay. What would be an appropriate fit right here at the end? Like, what would be an inappropriate fit? Maybe that would be easier. Which one's easier?
You know, I can't even say that because I used to say, you know, if you're not ready, don't come to me. But the truth is, are we ever ready? So I think even I probably shouldn't have said that because the truth is it's just, I think after a brief consult, most people, they really are kind of ready. Very rarely do I find people anymore that aren't really ready for change. I think humanity's changing. We're all ready to improve. Mm-hmm. You know, with the presence of the internet and the globalization, we're all ready for better. So I don't know if there is an inappropriate. But if you are inappropriate, if it's not going to help you or benefit you and only drain you on some level, then we'll find you the right kind of person that can help you.
Okay, wonderful. Thank you so much.
Okay, thank you.
I hope you enjoyed that interview with Dr. Lorri as much as I did. You can tell I really had fun with it. You know, even that piece at the end around are people ready for change, I found fascinating. Definitely the zebra stuff. Yes. Being in lockdown in your house at 1 a.m., I totally get that. And then you're like, yeah, actually, why am I terrified here? And let's retrain the brain and move that memory back somewhere else so it doesn't have to dominate your experience of life anymore. That I found fascinating. But back to my original thought, I also really loved the ending piece. You know, it's fascinating to say, are you ready for change? And once you make that call, are you ready for change? And it really does vary for people, but most people are ready for change at some level when they're calling someone for help. Absolutely. I know I offer a free consultation in my practice to see if we're a good fit. And for me, that's more like I want to make sure that I have the training to be able to help you with whatever you're dealing with. Most of the times it is a good fit because people do so much research ahead of time on the internet these days. But occasionally it's like, no, I really need to refer you to someone who I feel like is more of a specialist in this area than I am. It's a little bit different for therapy versus hypnosis. But even with hypnosis, occasionally it's like, I don't really have the training to do that piece. So I know someone who does, though. Generally, I can find someone for somebody. I also want to point out that I said Katie Byron during the interview, and it's actually Byron Katie. I always get her name backwards. So if you go to the show notes on the website, the link to her work is there. It's really valuable stuff, and it may resonate with some of you. All right, I'm going to wrap it up for this week, people. Hope you have a wonderful, wonderful week. Peace. If you like this episode, do me a favor and rate, review, and subscribe on whatever player you like, or even better, tell a friend so that more and more people learn about hypnosis and how it can be helpful for them. If you want to know more about me, head over to drlizhypnosis.com. That's DRLAZ hypnosis.com. You can see the downloads and see if there's one that's helpful for your life. Or you could also join the newsletter and get a couple of free files, as well as lots of good content. I've written a newsletter for well over 10 years. Go ahead and subscribe and join the rest of the world. All right, people, have a wonderful week.